All right. Good morning, everyone. Hopefully you can all hear and see me.
Morning.
Thanks, Robin. We're going to go ahead and get started. We have this is our third Steamboat Ready webinar. Thank you all for making time to join us. Steamboat Ready we've been working on this for many months. Collaboration between the Routt County, City of Steamboat Springs Chamber, and the ski resort, among others. We wanted to have a platform where we could share updates and information and answer questions as quickly as possible. A while back, we were hearing that the need to have more information, more insight on forecasting and what plans were. So that's kind of where this was born out of. Today, our main presenter is Roberta Smith, the Routt County Public Health Director. But before Roberta presents, we will dive into a few brief updates from various entities and industry representatives. Before we do that, I wanted to just acknowledge what a challenging week this has been. I know it can feel very defeating, but I also know how strong our community is, and that no matter what, we continue to dig deep and find that extra energy and commitment to our community and our friends and our neighbors. So thank you for everything you are all doing to move us in the right direction. I am Kara Stoller. I think I failed to share that. I'm Kara Stoller, the CEO of the Steamboat Springs Chamber. And I'm just going to share a few brief updates about what the Chamber has been focused on in the last couple of weeks. That certainly changes by the hour, though. So, but we have been really trying to encourage businesses to be prepared for all levels in the dial. Now we're actually experiencing it. So hopefully that message was taken to heart, and then also planning for no longer if, but when a staff member, team member has a positive test. Make sure that that plan is ready to go so that when you're faced with that challenge, it's easy to implement and it doesn't kind of freeze you or freeze your business up for too long. And then the last piece is certainly what I know so many of you are working on as well, is communicating the critical need for us to do what we can to decrease our COVID-19 positive case count. That really is what we need to get our businesses moving back in the right direction. We are also working to support as much as possible the industries that have been hit more severely than some others, specifically restaurants and fitness, with the recent restrictions that have been put into place on those industries. We want to do everything that we can to support them and make sure that the community knows how they can support them as well. And we will be sharing more information soon, but working on additional support for businesses in partnership with the county, and hope to have more information to share with you guys early next week. And then some things do carry on in this time. We do have our economic summit tomorrow, so hopefully many of you can join us. And I always want to make sure that if you feel as though you want to either connect more or that your voice isn't being heard, please know that you can reach out to me and I will do what I can to plug you in. We have a lot of different groups that are meeting very regularly, and we would love to have you participate if you are interested. So reach out. With that, I am going to introduce our city manager, Gary Suter, to provide a brief update from the city perspective. Gary?
Thanks, Kara. Appreciate it. Good morning, everybody. Yeah, certainly trying times are upon us, and I do look forward to the economic summit tomorrow. So it helps to have some sense of normalcy, I think, at least for my state of mind. So thank you. A brief update from the city. We did receive some CARES funding, and I know Winnie Della Quadri is administering that, and we're purchasing PPE that we can provide free of charge to the businesses. There's a couple of things on our agendas that are coming up. One is going to be an emergency ordinance. I think that's at the next meeting scheduled early December. I believe it's December 1st, that waives tap fees for outdoor dining. Anytime you expand a restaurant or a business, then the water district and our water department, we say, oh, you're using more water. We charge you tap fees for that. So we'll be waiving tap fees for that. Any expansion for outdoor dining. We're also going to be looking at another emergency ordinance. This is our second meeting in December. I think it's the 15th, where we will have an emergency ordinance that doesn't require first reading, second reading, and that will be for common consumption at the base area. So we did that for downtown. There wasn't a lot happening at the base area this summer, but we need to provide that same opportunity for the ski area base, which I think will be pretty cool. And I hope it never goes away. That's just my professional opinion. So we got that coming up. And I know our planning director, Rebecca Bessie, has been meeting with businesses and restaurateurs, and they are looking at providing to-go parking spots so that we could buy some signs and do some to-go parking spots. So all these things will require some sort of city approval and signage, and we'll do whatever we need to do in order to help accommodate these businesses in these trying times. A couple of other announcements. As soon as we went to level red, I announced to City Council on Tuesday night that when we went to level orange, that our staffing is way down. We're down to like 9 people in City Hall. As of tomorrow, we can only have 3 people in City Hall. So effectively, we're shutting down City Hall and city facilities. So those city offices will be closed after today due to the elevated risk level. Citizens can conduct their business by appointment. I'm proud to say we've had very few complaints during the pandemic. We've had very responsive staff members. So you can call, email staff, not too different from earlier this year. City Council, Planning Commission, Parks and Rec Commission meetings are all going to be going to all Zoom, all virtual meetings now. Municipal court is also going to be closed. They've adapted, but they're going to be closed, and individuals with pending cases can contact the court via phone or email. You still have the box outside City Hall for utility payments, and also there's online payments and channels that you can find out about by going to our website at steamboatsprings.net. Recreation is reviewing our programs under the new guidelines. As you know, pivot is like the word of the year. So everybody's had to pivot so much, and that includes our rec department. Howells and Ice Complex is going to remain closed until Monday, 11/23, and then it will reopen by reservation and only for 10 people or less per session. Howells and Hills Ski Area will announce its plans before the Thanksgiving holiday. I think they still have an opening day planned for before the end of the month. Steamboat Springs Transit, the airport, public works, streets, we're all still going to be providing those key services to the community, but we are making adjustments to operations, and we, like many other businesses, have quarantines, and we've had employees with kids that have been tested positive, and so we're having to scramble as well to keep our staff full and keep our services at the high expected level. I do want to mention, excuse me, our community survey is going out soon to 2,000 randomly selected residents. If you do get that, please follow the instructions. Please fill it out, because it really gives a good basis for City Council, statistically valid information that they can take and form their policy decisions going forward. I just want to wish a happy Thanksgiving to everyone and a safe Thanksgiving to everyone. I was sitting in on the chamber board meeting this morning, your emergency meeting, and there were lots of good ideas that came out. I don't want to steal your thunder, Kara, but there's some really cool stuff that's out there. Oh, and I should say, last but not least, we are the fiscal agent for the SOS campaign. So I got an emergency call last week, Friday of last week, saying, there's this effort being put forth, and we'll hear about that from Robin later, hopefully, And but they needed somebody to basically channel the money through. So I advised council of that on Tuesday night. I just made an executive decision, said, yeah, we'll pass it through the city offices and we can disperse the funds, collect and disperse the funds that come from the community foundation. So they'll go to the community foundation, then they'll go to the city, and we'll disperse them from the city. So doing everything we can to assist businesses and residents in these trying times. We appreciate everybody's patience, and please stay safe. Thank you.
Thanks, Gary. And thanks to you and all of City Council, as well as the city staff. Everybody has been ready and willing to jump in at any time. So thank you to your team and to you. Really appreciate it. Next up, we do have Robin Cragen. So that was a great transition. Thanks, Gary. Robin Cragen is our Lodging Association Chair and owner of Moving Mountains. And Robin is here to provide an update on the lodging industry. Robin?
Hi, Cara. Thank you for the opportunity to speak to everybody this morning. And just to follow on from what Gary was saying, thank you also to the city for the way that you, amongst many others, have stepped up to help this initiative. So with regards to lodging, I'll speak to that first, and then I'll come to the SOS campaign. I think everybody is extremely nervous about the way things are looking, and we're ready to have a great season. The majority of us have great reservations on the books. We're looking at a reasonable winter season. It's not as busy as it was going to be in the past few years because we've lost most of our international travel, and there is definitely still some hesitation on the part of our visitors to get on an airplane and to come here. But at the same time, what we're seeing is many people have crossed that bridge, and many people have realized that they want to have a vacation and that Steamboat Springs is a place they want to come to. We should feel really good about that, because my greatest concern back into the spring was if this pandemic causes a 9/11 style shutdown of travel, then that might be something that we can't control. But the demand is there just as it was in the summer. We believe that we have everything to play for. And as the lodging community, we're definitely talking about the fact that we adapted our businesses in many, many different ways to be safe for our employees, for our guests, to come here. And we worked hard to make the case for winter through what we did this summer. And I think that we executed on that extremely well. County commissioners have been very complimentary to the lodging industry. So as much as they can be on our side, and obviously they're balancing a lot of different competing concerns, but I feel that there's not too much that we didn't do and that we could have done. So we have done everything we can to make the case for winter, but that's what leads me naturally into the SOS campaign, which is really not a campaign originating from the lodging community. It's originating from me and another fellow lodging company owner, but as members of the community, saying that the problem, I don't think that the problem that we're having right now with our cases lies with our businesses, not so much as it seems to lie with our communities. Our case numbers have jumped significantly at a time when we don't have a lot of tourism in town. And that's really concerning. There's one thing you can do. There's certainly things that you can do if you can point your finger at what's causing this problem. And we're not seeing a lot that really leads us back to that this problem of case counts soaring that's going on all over the country for sure, but it's rising in our community, not because people are staying in our lodging, and in many cases I would say it's not because people are dining in our restaurants. It's what we're doing in our social time. It's what we're doing in our personal time that's unregulated. It's out there in the community. So as I sat with Sarah Bradford from Steamboat Lodging Company saying, what else can we do? We came with the idea that maybe we need to really send that message that this is an emergency for our community. And our community is really stepping up to this message. So the campaign is called SOS, Save Our Season, Stop Our Spread. We had this incredible marketing concept developed for us by STA, a marketing company here in town. And so we all kind of worked on this over a weekend just 2 weeks ago now. And I have to tell you that all the things I've done in marketing, I don't think I've seen anything take off like this. We are getting incredible connection with people in the community. It's helping, I think, show people that are worried about losing their jobs and losing their livelihoods and everything that goes with that, that we need to do something ourselves, that the county commissioners have given us the 5 commitments of containment, that the chamber has sent us messages about wearing a mask and washing your hands. We already know at this point, if you've got to be living under a rock if you don't know that you should be wearing a mask in the company of others. But it doesn't seem like we've been connecting the dots. And it's quite likely, in my opinion, that when there wasn't much COVID in town in the summer, that what we could get away with socially back in the summer isn't going to work now. An interesting thing that I heard on the news just yesterday, we all know how the cell phone companies can track our activity and can show behavioral patterns. And the behavior, our activity in Colorado, the level of activity between all of us was identical in September to what it was from the prior year. So it shows you that despite there being a pandemic with cases rising, that we were not changing our behavior. And this message is really public education about it's on us. If we don't act, then we are going to we're gonna lose the ski season. And it doesn't take much to think about what that means to many of us that work in the industry, or those of us that are somehow connected to people coming here. So the response has been incredible. We've had coverage from 3 of the Denver TV stations. We're running radio ads. We're running an extensive social media campaign. So you'll see those ads. If you're on social, you should see those ads cropping up. We've got ads running in the Steamboat pilot and the Valley Voice and things like that. Additionally, I'll tell you that this message is resonating around other mountain communities. So the wonderful thing that we're hearing is other communities are looking, that we're all facing the same problem. We're all worried about losing ski season. And what I think is helpful for us is that we're just one community, a small community in a big state. And when all the mountain communities join together, it's possible under this SOS message that we can show that we are, we really need to change this situation ourselves. And so this has been picked up. We've created a toolkit for other communities, and it's been picked up by Aspen and Breckenridge and Winter Park and other communities around the mountain areas. So it's turning into a much bigger movement. We have tremendous engagement within our community, and I encourage anyone who's listening to engage with us on social media and to get out there and communicate with your friends and your connections about how we need to change the way. The fundamental thing that's been missing is not the face mask wearing or the washing of the hands. I think that that's already known and understood. It's the fact that we don't connect, that when we go for coffee with a friend, we just made them our close contact. Or if we sit down for lunch, well, we can't do that anymore, but hanging out in each other's homes, we're making each other close contacts. And if any of you have been contact traced, you know that that means that you're now on a 14-day quarantine because of the risk of you having COVID. So we're trying to educate people as much as possible that we need to do something too. I hope you guys will join the campaign. We're definitely needing, or there's definitely an opportunity to tell our story about what this means. And that will be our next level of engagement, is getting quotes and sound bites from people to be able to tell the story of what it looks like in this town if we don't have ski season. Anyway, really appreciate the opportunity to talk to you all. Any of you that are helping us, I so appreciate the amount of outreach we've had. It really shows that we have an incredible community, and we're getting a lot of feedback about how people are making changes to help us save the season.
Thanks, Robin. Really appreciate all the work that you're doing on SOS and for the lodging update. I think just circling back on that piece, that it's wonderful that we are still a desired location as so many people come and infuse their dollars here in our community and support people's jobs, which is great. And I know that we were hoping for next month to have more information on updates regarding transportation, including air travel, which is seemingly pacing well also. So thank you for that update. And we'll continue to stay in touch and keep the community posted on how lodging is progressing. Next up, I'm going to switch over to Kathy Elliott with Christie Sports. Kathy has also been chairing our retail industry work group. Kathy?
Hi, Kara. Thank you very much, everyone. The retail industry, thank you. Thank you to our community. Thank you to our visitors for supporting us through this time. It's been a struggle, but with small little successes that we've had. Business has been good this fall with more people staying in town. Our October sales were better than expected. For November, traffic is down, but people that are out are buying. The businesses were gearing up for winter with new merchandise coming in on a daily basis. Please come and check us out. We're working on ways to address the point of sale, the velocity at the cash registers, adding second points of sale systems, touchless points of sale systems, so that we can make it easier and safer for our guests to come downtown or on the mountain, shop and make purchases. We've been working on best practices for the holiday seasons with the additional crowds that we are hoping and expecting. What can we do differently, better and safer to maximize our sales and our customers? You know, all of the measures have been done to ensure the utmost safety of our customers and our staffs. So it's never been more safe to come out and shop. And we're asking the public to please stay and shop local, especially now with the Christmas seasons and the holiday seasons coming in. We're all staying positive and adapting and adjusting to the changes that are being placed on us. The silver light of shining, I guess you could say, is with us going from orange to red. Our retail capacities have actually been able to go up from 25% to 50%. We are gearing up for Black Friday and Small Business Saturday events. We're ready to go. The downtown businesses have flyers that have more details on this. So we're asking you to maybe not look at Amazon just yet. Come down and check out what we have to offer at all of our retail locations throughout Steamboat. And you know, we're also looking for a little help on the side. Support, you know, finding employees has been a challenge even before COVID. But now more than ever, we're hoping that we can team up with our restaurant associations, our lodging and our ski corps employees that maybe not have full-time employment yet that are looking for a few hours. We need some greeters. We need some help to make sure that we're staying at capacity. The stores are safe with the crowds coming in. So please come and talk to some of us because we are looking for a little bit of part-time help. And we're hoping that that'll help you guys get through until the restaurants are back open for in restaurant dining and other things. So, you know, we're doing okay, and we have very strong shoulders, and we're thankful for the leadership of our chamber, of our city, and our county, and we're doing okay. But we need the help of the local community to continue to shop. You know, we'll need economic relief from the state and the national governments if things continue to stay as they are, or if we go into purple. But we're very optimistic, excited for this winter, expect a great ski season, that it's going to be safe, that our community is going to rally together and ensure that we can get our numbers down and have a great ski season. So thank you.
Thanks so much, Kathy. I think now more than ever, we need to do our best to shop local. I know that we've talked about it before and how sometimes it seems so easy just to be on your computer at home and order something online. Now so many of our local retailers have set up online purchasing sites, but also just popping down to a store makes so much difference rather than purchasing online. So we will certainly be carrying that torch and as much as we can to support Kathy, you and all of the retail industry. So thank you for being here and for all of your work.
Thank you.
Next up, I'm going to shift over to Dave Hunter, who's the VP of Mountain Operations at the Steamboat Ski Resort for an update. Dave?
Yeah, good morning, everyone. Thank you, Kara. Thanks for the opportunity to speak and provide an update from the ski area. You know, we continue to say what most people are saying. There's one thing we know is certain: things will change, so be ready to adapt. And once we adapt, things will change again. It's kind of the world we live in. I thought I'd start off with just a quick explanation about our decision, our difficult decision to delay our opening to December 1st. This was purely based on conditions. Everyone knows how warm it's been this week, which really doesn't provide for continual snowmaking opportunities. Normally, it would be no problem for the resort to open with just Christie Peak down and a couple of trails. But this year, taking into consideration our mitigation plans, the responsible action for us was to wait until more terrain and lifts were available for skiers and riders to be able to spread out. We continue to adapt our contingency plans based on where we are on the dial. We now have plans for the new red as well as plans for the new purple. We'll continue to adapt as our county moves through the dial and hopefully heads back towards the blue. We're very grateful for the collaboration between the county, the city, the chamber, and the ski resort, as well as local businesses. It's really helpful to be able to have discussions with all these different entities and understand best practices and figure out how to move forward in these strange and difficult times. We're especially grateful for our collaborative partnership with Routt County Health Department. We've been able to have really helpful conversations with them throughout this entire pandemic, which allowed us to build a very thorough mitigation plan and what we call our operational playbook, which was actually approved by the CDPHE late last week. Like everyone, we're too concerned with the cases spiking in our community, and we're doing our part to make sure our staff adheres to the now 6 commitments to containment and follow our mitigation plans to help minimize the spread. We're going to continue to work tirelessly every day to find the balance between welcoming guests, to keep our economy thriving, while at the same time, making sure we're focused on keeping our employees, our guests, and our community safe and healthy. So thank you for the opportunity and great work for this community.
Thanks, Dave. I know everybody, including yourself at the ski resort, just echoing what you shared, have been doing backflips to try to figure out how we can move forward and provide certainly an opportunity for our guests to come and enjoy the outdoors, but also that piece for our local community and how important it is for all of us to get outside and have fun, especially in this time. So thank you for everything that you're doing and for your partnership.
Yeah, we're looking forward to getting the ski area open and providing that outdoor recreational opportunity that we know the community is thriving for. So yeah, thank you.
Yeah, thanks, Dave. All right, next up we have Mark Stanford, who is with Truffle Pig and Carl's, and Mark has been a key contributor and leader to our restaurant industry work group and a lot of work that's happening both locally, but also at the state with the Colorado Restaurant Association. Mark, thanks for joining us and providing an update.
Hello, everyone. On behalf of the restaurant industry here in Steamboat, thank you for joining the webinar today. And Kara, thank you for allowing me to speak on behalf of the restaurants here. It should come as no surprise that the restaurant industry as a whole has been one of the more heavily impacted industries here in Steamboat, with taking a step back from orange to red. The tone and temperature of the industry right now, it's a little different than a lot of others, given that our main source of revenue has just been cut off. And we're between today and tomorrow, over 1,000 people are going to be laid off or furloughed with our businesses. Which one thing I do want to say is that we understand our place and our role in mitigating the spread of COVID in our town. It doesn't make the burden any less difficult to bear. So what we ask the general public right now is just be mindful that these businesses, we're in a struggle right now. We're pivoting. And when we say we're pivoting, it means that we're reworking concepts that we've had established for quite some time, that we've figured out with seasonality. We've been able to employ the people we employ. We've found a way to sort of fit into the greater good of the community. And some restaurateurs are doing it very well. Some are having a more difficult time figuring out how to transition into takeout only and to-go only business right now. And something else to keep in mind as we consider all those is that, we're still paying the same taxes we're required to pay. We're still paying the invoices, we're still paying rent. We're required to pay the amount of money we normally pay while losing 90% of our business. So it's going to be difficult, but we're looking past the next 5 weeks. We're looking past the ski season. We're looking to what's coming next. And our main goal right now is pivoting our businesses into a way that we can sustain ourselves and remain viable through this, so that when we come out on the other side, we can re-employ these thousands of people that are now without jobs. And we can open our doors again and provide a unique resource for people to come out and socialize and enjoy good cuisine, and really keep ourselves established. We had a call yesterday with a handful of restaurateurs here in Steamboat. It's a very fluid situation. Things are changing. It seems like every 10 minutes. And again, while we are totally acquiescing to everything that's required of us right now, there's some stress. There's some serious concern for how long this shutdown is going to last, and what we can do to contribute to the health and safety of the community while also being able to open our doors again. So supporting local business, echoing something that Robin brought up and something that Kathy brought up, and also echoing what Dave Hunter said, keeping it local, keeping focus on the community right now is great. If every $20 spent in Steamboat can change hands 5 times in Steamboat before it leaves the valley, businesses here will do much better this holiday season. When you're meal planning for the week, consider different takeout options at different restaurants. And if you're loyal to a restaurant in town, whoever it might be, continue going there, continue getting takeout, continue supporting that business. Businesses are keeping a handful of staff employed right now, engaged. A lot of them are kind of key and core employees. But, I was talking to my wife about this earlier. It's sort of laying this many people off, with our restaurant group, roughly 129, 139 people are getting laid off today and tomorrow. It's like sending your family to the guillotine in a sense. These are people that work really hard for us throughout the season to keep our businesses supported. And we're already running on razor thin margins because of seasonality. So it's really tough to consider what's to come next. So supporting restaurants is key. There are some really unique and exciting things happening. And you're going to see what restaurants are doing and getting creative to keep social distancing intact when we are able to open again. We're really focusing on delivery and takeout right now. Gary Suter alluded to the various parking spaces downtown that are being allotted for takeout delivery. We want to make it easy for our guests and our customers to come and support our business. The last thing we want is a major inconvenience or some sort of a barricade between you and being able to support restaurants in Steamboat. The work that the city has been doing with us on expanding liquor and public consumption boundaries has been absolutely amazing. Rebecca Bessie is somebody who's done amazing work. Tara Stoller here has been just a massive advocate, and her and I exchanged an email, and she uses the term we. She is part of the industry. Whether she works in the industry or not, she is part of this industry right now. And really, restaurants feel more attached to Steamboat than ever before because of the outpouring of support we've seen. One thing I think is not considered in the grand scheme of things is the well-being of these hourly employees that are currently out in town now. A lot of them, this is their only job, and the other outlets to obtain part-time positions aren't available right now. We're working with various organizations in Steamboat to create employee relief funds. We're working a lot with the CRA, which is the Colorado Restaurant Association. We have multiple board members on the state board here in Steamboat. And the board here has been very active in trying to figure things out. Nick Sharp with Rex's group has been doing amazing work at the state and local level to make this happen. I look forward to working closer with him through all this. But it's a tough time. We've got to make it through this so we can make it to the other side. We are very dependent on the lodging company. The lodging industry. We're very dependent on the resort. So we want a very symbiotic relationship with Robin and that industry as a whole, and with Dave Hunter, Rob Perlman, Rob Spencer at the resort. They've been doing a great job keeping us up to date. But just continue thinking local. Continue thinking how to support local. A lot of people are going to be very heavily impacted by this. So anything and everything that we can do to keep things moving for restaurants will be huge. As far as mitigating the spread of COVID in our community, we are doing everything we can. We live or die by sanitation in restaurants. Our job is not to make people sick, even when there's not a international pandemic. We need to find ways to keep people safe. We need to find ways to kind of recreate sanitation right now, and we're doing that. Supply chains are shutting down in a sense. It's really difficult to get some of the supplies we need. So Main Street Steamboat and Lisa Popovich have done a great job of providing us with some of those necessary materials. If you're looking for unique ways to contribute to restaurants, if you have the ability to donate gloves or bleach and things like that, things that we can use to produce food in a safe manner, deliver that food to our guests in a safe manner, that is the biggest thing right now. But Yeah, it's changing every minute. We're trying to keep up. You know, what I say right now may drastically change next week and may drastically change the week after. So we're staying the course. We're excited to come out on the other side. So yeah, just thank you to everyone for all you're going to do in the coming weeks.
Thanks, Mark, so much. I think I've shared with many of you that we set up 14 industry work groups, and restaurants was one of the ones that I was assigned to or assigned myself to. And I do feel very much part of that team, even though I don't actually work in one of the restaurants. But we did have a very, I would say, grim meeting yesterday, talking about just what Mark shared, the many, many friends and family and neighbors that are going to be unemployed here very soon. With that, we can take action. Going back to SOS, we can all do our part to reduce our case prevalence, and we can all help support those restaurants by getting takeout. Simple as that, support them as much as possible. And as Gary mentioned, we did have a special chamber board meeting this morning where we were strategizing additional ways that we could support certainly restaurant industry, as well as fitness and others who have been impacted more so than others. So thank you all for making those updates, and thank you to all of our attendees for supporting our local businesses. Now I'm going to shift over to our main presenter, who again is Roberta Smith. She's our public health director here in Routt County. I know that we are very lucky to have her today. Roberta's time is, there's not much of it to spare. So we really appreciate you making time to speak with this group today, Roberta, and sharing some updates and answering questions.
Absolutely. Thank you, Kara. And thanks to everyone that provided updates. Robin, we may have to hire you in public health here. Your message is right on target, and it's really what our community needs to hear. When the campaign first came out, I switched my Facebook photo to the SOS campaign. I'm going to be sharing that with our other local public health leaders to see, you know, how they can get on board as well, because I do think there is strength in numbers, and you know, we aren't our own county. We work with our other county partnerships as well, as I know the campaign is, and just if we can strengthen that message all around, I think for Coloradans it will be very, very helpful. And Mark, I appreciated your comments as well. I actually wrote down your quote of every $20 will change hand 5 times in Steamboat. That's powerful. We need to get that message out. I myself try to shop local as much as I can, and we've got some amazing stores and resources here in Steamboat that there's really not an excuse not to shop local, because you can find the majority of this here, and it's just really great to be in this community. And I do thank everyone for your efforts. I know it's a difficult time right now for everyone, and I do think, though, if we do these measures now, we have to see some relief with this, and there is hope too with a vaccine coming out, so that's pretty promising news. But I can tell you, I don't sleep at night. And it's just, I can only imagine what everyone's going through. So please, I'm in this with you guys as well and want to be your partner. When Kara and I first talked about me coming and doing a presentation, I thought we would be kind of at a different spot in our world. I'm like, oh, maybe people will be, you know, done talking about coronavirus and maybe not wanting to talk about mitigation plans. But really the scope of my presentation today is, you know, we talk in the Board of Health, we give updates and everything. And I think it might be of some value, and if it's not of value, you can tune me out. But just to kind of go back to the basics to kind of understand where this virus came from, what it does, how it's transmitted, and how really the measures that we can take as a community can contribute to decreasing transmission. So it's just really a COVID 101, but I do have some frequently asked questions and resources at the end of the presentation that hopefully will be helpful to you. So I'm going to just share my screen here with my presentation. And I threw in also some myths. I know there's some misinformation that is out there, so I wanted to address some of those as well. Let's see. I think, hold on just a second. There we go. Okay. So just a little bit about me. I mean, everyone knows me from the Board of Health meeting, but you know, I enjoy things here in Steamboat as well. My background is I'm a nurse with my certification in infection control, infectious diseases, and occupational health. I'm also an industrial hygienist. So my background with OSHA and understanding work-related issues and how companies and industries need to operate under those OSHA parameters and some of the design features that we talk about when we look at the spread of coronavirus. That's really my background, and I did that in a healthcare setting for many years. But you know, I enjoy all the great things that Steamboat has to offer. My husband and I are big tandem riders, so you might see us on our gravel tandem or our road tandem around town. I do want to highlight though I am not a virologist, nor am I a physician. So I just have that nursing degree and a master's in public health. But I try to go back to this a lot with people, that coronaviruses have been with us for quite some time. We have strains of human coronaviruses that we see in respiratory seasons. And we've seen these for years, going back about 70 years when they were first identified. And the thing with coronaviruses, very similar to influenza viruses, is they can infect many species, including humans and other animals. So this is when we talk about the origins of some of these pandemic viruses, you know, that was always kind of the worst case scenario when we were doing influenza pandemic planning. When I worked at CDPHE, you knew it was maybe going to come from an avian species or a swine species and mix with humans. And this is what we saw with coronaviruses, because they can jump species as well. In 2003 is when we first had our experience with a novel coronavirus, and that was SARS, or the severe acute respiratory syndrome. And then since then, we've seen now 2 new human respiratory coronaviruses, and those would be MERS and then our current COVID-19. So when we did see SARS, you know, that really was short-lived. We were preparing for that in healthcare settings, and we saw an impact pretty heavy, and then it just kind of went away. I mean, we do see occasionally cases still of SARS, the original, pop up. But, you know, that was a pretty limited spread. And what we know about that is that that came from horseshoe bats. We also saw the Middle East Respiratory Syndrome, or MERS, in 2010, and that really hit Saudi Arabia and a lot of the Middle Eastern countries hard. And what we saw with that virus is it actually jumped species from camels. And our current COVID-19, the likely origin is bats. Now, you know, I think maybe people understand the name now, but when we do identify new viruses similar to influenza viruses, they are generally labeled with the year they were identified. So that is where COVID-19 comes into play. It's not that there's 19 COVIDs. It's just that this novel coronavirus was discovered in 2019, as we all know, and the likely culprit with that is bats. So we can blame bats, I guess. I wanted to go over the symptoms because what we find and what we're seeing lately with our reported cases is a lot of people saying, oh, it was just a cold. Well, really, this is a cold, and it's more severe symptoms, and it's affecting us more severely because it's a new virus that we haven't seen before and we don't have much immunity to. But the symptoms can include cough, shortness of breath, fever or chills, muscle or body aches. Sometimes we see people that have vomiting and diarrhea. And really the sentinel case is, the sentinel symptom, is the new loss of taste and smell. Actually, in our school setting for the school guidance, if you have a student that loses taste or smell, then that is an automatic send home and cohort the class, because a lot of times, about 80% of the time, if you have that symptom, you will test positive for COVID. So, you know, you can have one of these symptoms, you can have all of the symptoms. We talked to a case recently that had a sore throat and a runny nose, but didn't have a fever, and they didn't think they had COVID, so they went to work still. So just checking for fever is really not the best strategy. You want to be doing those symptom checks for all of these symptoms, because these can be clues. These can identify early on a potential case of COVID-19. Now, it could be also influenza, and that's why we encourage everyone to get their flu shot this year, because many of these symptoms, especially the fever and the body aches, are very key symptoms in influenza as well. So at least if we can prevent one disease through a vaccination that we currently have, that will help rule that out when you are trying to see if potentially you have COVID-19. But I guess the bottom line is, if you do have symptoms, we want you staying home. We want you to not have contact with folks. We want you to get tested, and we don't want you going to work and having contact with others. So we talk a lot about, you know, close contacts and transmission. Again, I kind of want to get back to brass tacks on this and really understand this is a respiratory virus, and it infects the respiratory tract through droplets that are expelled from an infectious person. So that close range that we look at for close contacts is 6 feet or closer. Now that is a number. It doesn't, it's, you know, it can be, you know, a little bit further than that, but generally what we're seeing too with our cases is people like household contacts that have closer contact for those long periods of time. We are seeing the virus spread very easily within households because of the duration of contact. So that doesn't mean it can't spread in a shorter time frame or setting. So this is why we look at the cumulative 15 minutes or greater, and in that close contact for that definition of a close contact. This picture here of the gentleman sneezing, I think, is a classic picture that we've used in infectious diseases for quite some time. And when you sneeze, or cough, you are expelling these droplets, and this is what is infectious. So if you're within, so think of it as someone's fire hose, and you've got a fire hose of droplets coming out of someone's mouth when they're talking, singing, sneezing, coughing. That spray zone is why we wear masks, and this is why masks have been proven to be effective in decreasing transmission of COVID-19. So if you protect that, so if you eliminate that spread, you're also eliminating the chances of being infected with those droplets. These droplets then can fall to surfaces. So that's why when we talk about principles of cleaning and disinfection, we want to make sure that we're cleaning surfaces and high touch places, because you can have viruses on the surfaces. They don't survive very long. These are respiratory viruses. viruses, they're envelope viruses. Once they leave the host, they need the person to survive. Once they leave the body, they just start dying. So we expedite their death through cleaning and disinfection principles. How can we stop the spread? I think we've gotten this all kind of drilled into us. This is really the basis for our 5 commitments and 6 commitments now to containment. But really avoiding close contact with people that are sick, covering your cough and sneeze. It's still amazing to me to be on a Zoom call and someone will cough or sneeze on a Zoom call and they don't sanitize their hands afterwards. You know, just because you're on Zoom doesn't, you know, make you free of doing regular hygiene. Have some bottles of hand sanitizer close by. So if you do cough or sneeze, you can sanitize your hand and cough into your elbow. Stop touching your face. This is also another thing that I see constantly in meetings. You know, people are doing this or doing that. We touch our face so many times during the day, and we need to get back to this practice of being hyper vigilant about washing our hands. Don't touch your face, and really making sure that we aren't giving this virus an opportunity to take hold in people that are susceptible. Like I mentioned, cleaning and disinfection of surfaces, frequently touched surfaces such as door handles, faucets, you know, tabletops, those types of things. Stay home if you are sick. It still blows my mind when we have people that we are interviewing that are positive with COVID that went to work or went to someone's house sick. So stay home and take care of yourself and don't come in contact with others. Washing hands, again, going back to those simple hygiene measures, making sure that you're using soap and water for at least 20 seconds when you're using those products. Hand sanitizer is also acceptable. There are some time frames, there are some situations, however, where hand sanitizer is not acceptable. And we know this, you know, talking about restaurants, that you always, after using the restroom, you need to wash your hands with soap and water. If your hands are visibly soiled, it's best to wash your hands with soap and water rather than using hand sanitizer. There were a couple myths that were going around early on, and I just, you know, the World Health Organization did a really good job at addressing some of these myths. Some people were saying, well, just take a hot bath and this will raise your body temperature and will prevent spread of coronavirus. And that's actually not true. It can actually be dangerous to sit in hot water. I mean, the hot springs are really nice and we do enjoy those, but you know, just making sure that you're taking care of yourself. And fevers are a natural way for our body to fight viruses when we are infected with them, and that's why your body temperature increases, because your thermoregulation is changing to fight off that virus. So just taking a hot bath isn't going to induce a fever or create that same immune system response. I wanted to go over CDC, and I've got some links in here, and Kara, I'm fully willing to share the slides with everyone as well, because I do realize there's hyperlinks in here. So when we talk about cleaning and disinfection, they are 2 different distinct steps. So cleaning, it refers to removing germs, dirt, and impurities on surfaces. So generally, before you can disinfect, you need to clean a surface, because there could be some bioburden that is there that you need to remove so that your disinfection chemicals can effectively work on those surfaces. So getting the dirt and grime and bioburden off those surfaces first, so you can do this, you know, with wet rags, soap and water. When I worked in healthcare, microfiber cloths, actually there's some really great studies about microfiber that actually they are more effective than just using a cotton cloth when you're cleaning and disinfecting. So disinfection, again, refers to the chemicals that you're using to kill the germs on those surfaces. So it doesn't necessarily clean or remove the germs, but it kills them. It inactivates them. I'm actually doing a whole workshop tomorrow for a virtual conference on talking about different products and how they chemically will break down organisms. There is a list of EPA registered disinfectants for coronavirus. This list, was started way back early in the spring and is growing. The EPA regulates disinfectants as pesticides, so it's under their pesticide page, but you can look at this. This is list N, where you can look at your product that you're using to make sure that it is useful against coronaviruses. So like we said, cleaning those high-touch surfaces in your home, in your office, any kind of tablet. So if you're using an iPad or a tablet or a touchless, I guess a touchless system would be just that. You don't touch it, but even if you're signing like a pad or something like that, have some kind of surface on there that you can wipe off and disinfect. Sometimes these products, you need to go back to their manufacturer labels to see exactly how they can be cleaned. Again, using those microfiber cloths that are damp is really going to be helpful. This is an easy killed virus. It's not like a spore. It's not like norovirus that can live on surfaces and are hardy in terms of their structure. This is an envelope virus, and soap and water is going to be effective in removing the virus. You want to do that double check with the disinfectant then to make sure that you've cleaned everything. Again, kind of going back to your PPE and your OSHA to protect people that are doing cleaning processes. Make sure they're wearing gloves when cleaning. This protects them from the chemical they could be using and from any contamination that they could have. Again, another principle in safety and chemical handling is never mix products with ammonia and bleach. You want to make sure you're not creating more of a safety hazard with doing these types of things, making sure that all the chemicals you're using at your business, you do have your hazard communication plan and you have all of that information ready and you're applicable to all the OSHA regulations for handling chemicals. So again, we talked about cleaning high-touch items. We want to make sure that what you're using to clean is compatible with that product. Early on, people I saw were talking about using like the Clorox wipes on cardboard cereal boxes and wiping down their groceries. Well, cereal boxes, paper, all those things are porous, so you can't really clean them with a surface wipe, because those surface wipes are intended for non-porous surfaces. So making sure that the chemical you're using won't destroy the surface as well is also important. Bleach can be very corrosive to surfaces over time. We would see this a lot of times in healthcare, where you can see a buildup of these products, and it actually makes it difficult then to get that buildup off. So again, choosing products based on the compatibility with what you're using. Each product too has a contact time. And this is the dwell time that it needs to be on a surface before you wipe it. So spraying a surface, letting it sit that amount of time, and that will be listed on that product. It will be listed on the EPA website on how much time it takes to actually kill coronavirus will be listed there. And you don't want to wipe it or, do anything before that contact time is up, or else you've just defeated the purpose of using that product itself. The EPA has some really good information and posters if you need these for your businesses to educate people on appropriate cleaning practices. As we know, physical distancing is a principle we've been using throughout this pandemic. limiting guests, the numbers, we're seeing that in our current stage where we're at, making sure we have physical barriers so that people, you know, don't get closer to us, and making sure you have a good flow of guests in your facility and you're not having people bunch up and having to cluster in areas potentially. Again, I always stress to wash your hands. It's always important that you're doing this wherever you go. I wanted to add some frequently asked questions that I get from businesses to this slide deck as well. The link down here is from CDC. These are all directly from CDC. We have put this link on our Routt County webpage. And these are a lot of the questions that we get here at Public Health. So these CDC resources can help build your mitigation plan or can help walk you through different scenarios. So what should I do if an employee comes to work with COVID symptoms? So you want to be doing screening, first of all, to make sure, you know, that they aren't coming to work with these symptoms. I would also recommend, you know, doing symptom checks, you know, throughout the day, perhaps, or people might come down with symptoms throughout the day, and that's when you would want to enact these plans to send that employee home as soon as they report those symptoms. You know, things can change throughout a day, so you may not have a fever or these symptoms at the beginning, but maybe by noontime you do have these symptoms. So just relying on that first daily symptom check is maybe not the best practice. But having a process where employees report to someone, perhaps you have a COVID lead in your business or a team that they report that to and then go home. We don't want people who are sick, of course, coming to work, and if they've gotten tested, a positive test for COVID-19, they will be asked to isolate, and I've got some information on that here. Just some more questions. What should I do if an employee is suspected or confirmed to have COVID-19? Many places say, oh, do we have to shut down the business? In many cases, you do not need to shut down your business. You need to have that person isolate. Now, if you've had close contacts with that person, from a staffing standpoint, if you're not able to run the business because staff are quarantined, that's a different thing. But just from a contamination standpoint, you don't really need to close down your business. You would want to make sure you're still cleaning and disinfecting. If you're doing these things every day and having that as your normal practice, your business can still remain open and up and running. So again, making sure that the person that has tested positive obeys isolation and or quarantine for the other employees that were in close contact. Sometimes we find out days later that someone worked and then they had COVID-19. So the last time they came to work, let's say, was on Tuesday, but on Sunday they find out they have COVID-19. So you would go back, and we encourage everyone to have this plan in place. Public Health is here as an advisor, but really you can use these tools on CDC to help make those decisions on what to do for employees. So again, we would go back to those close contacts and determine who needs to be quarantined. And again, it really goes back to when they were tested, when their symptoms started. All of those scenarios would play into the equation of the isolation period. These are some good posters from CDPHE, just tips on quarantine versus isolation. Isolation is going to be 10 days from your symptom onset, or if you're asymptomatic, it will be 10 days from your positive test date. So we'll ask people to isolate. Right now, through Routt County Public Health, they will get a letter either telling them that they're on isolation or on quarantine. These are legitimate letters that we are emailing out to folks. I got a couple businesses asking me those questions the other day, but yes, these are automated when we determine someone is a close contact. Quarantine is for people that have been around someone who's had symptoms or has tested positive for COVID-19. This is 14 days. You cannot test out of quarantine. If you get a negative test on day 7, you still have to serve your 14 days. And we've been trying to reiterate this to people. And this is what I think has contributed to some of our spread, is people are not heeding these isolation and quarantine orders to the T, and they're going out and interacting with people when in fact they shouldn't. Just some resources here on how to discontinue isolation. Again, 10 days, but if you still have symptoms, we ask you to be symptom-free for 24 hours before being released from that isolation. I also wanted to put some resources on here for businesses. If you're developing, hopefully you've developed your mitigation plans, but again, those should be ever changing and adding information as it comes out. CDC is an excellent resource. OSHA for employers, another great resource. Again, if you're over 10 employees, you are subject to OSHA regulations. I put the American Industrial Hygienists Association on here. They've got really good specific guidance for specific industries. And then some of those FAQs that I walked through are on these links here. And again, we put those on the Routt County resource page. So that's all I had for you today. I hope that answers some questions. And I think we might.
Roberta. Yeah, we have a few questions. Thank you for the overview. We really appreciate it. I know we're over time here. We will send out Roberta's slides and links so everybody has that. And if you can stay on with us, we'll try to get to as many of the questions as possible. The first one I'm going to hit on is probably for Roberta and Dave. Can you guys just touch base on how you're working together to put together guidelines? I know there's a lot of playbooks in action, not just for our ski resort, but for the state as a whole. And then same question goes for lodging guidelines and plans that are in place in tandem with public health and that industry.
For the resort, you know, our collaboration with Roberta and her team has been nothing short of phenomenal. Our risk and safety manager, along with a couple of other folks on our kind of main task force, meet with Roberta at least once a week. What's going on now in the community, probably more like daily. And just, you know, I think that that's probably the best silver lining, if there is one, is just the amount of collaboration and help that's out there to help guide us through this process. And again, as I started my my update earlier, you know, what we talked about yesterday often is completely different today. So it's continually evolving, and we just try to stay as flexible as we can.
Mm-hmm. Yeah, and I echo that collaboration also from a state level. I do meet regularly with other ski counties, and we discuss some of the challenges that we're having. And it's been really good to have those resources and have that partnership to, you know, if something pops up, you're like, oh, we didn't think of that. We've got a really good process with the state to really go over what would be the best solutions in some of those instances.
And then I would just add in closing to that is, as Roberta is having those conversations, we're also extremely close through Colorado Ski Country, who works in conjunction with the state and the governor's office as well as far as what the state guidelines were for resorts in Colorado, as well as working directly with our parent company, Alterra Mountain Company, and learning from our, you know, from our peers within our portfolio as well at the same time.
Great, thank you. And Roberta, do you mind just hitting in on lodging, and Robin can chime in as well, the protocols and requirements that are in place for mitigation efforts?
Right. And, lodging takes many forms, where we have our designated hotels or condos, but then we also have short-term rentals. So really, from our perspective, from a public health perspective, it's key that people understand cleaning and disinfection and turnover with some of these facilities. We do get some positive cases that are visiting here, and it's always important to let people know, that they need to be following those procedures. Like I said in some of the Q&A, sometimes you don't find out that someone has COVID-19 until maybe 4 days later, and they're back home and they're out of the facility. So that's why I think we really emphasize having these procedures in place and treating everyone potentially as if they were infectious with COVID, because you never know who's going to be that person 4 days from now that will test positive, unfortunately.
Yeah. Thanks, Roberta. The next question I'll chime in on, there's a question about communicating the lodging properties, communicating out to guests who have arrived. I know Robin alluded to it earlier, but I would say that the lodging community has done a tremendous job in terms of being that first communicator out to the guest, making sure that they are very well aware of where we're at in the dial. That I would say is, the more of the commercial property managers, and but we do also have a lot of individually managed properties for rent that is maybe like a side business for someone, and they might not be fully up to speed with everything that's going on. So we do have some challenges there, but I would say as a whole, that group has done an amazing job of preparing guests for their arrival and what to expect, and that it really is a two-way street. Our team was really focused on that as well this summer to make sure that the expectations were communicated in advance of arrival. Next question hit on, and Roberta, I'll ask you this one. Just how does the timing work? So we're in new red. What needs to transpire for us to go? I would say probably either direction, but more so, what do we need to do, and what's the timeline, potential best case scenario to move back down to orange?
Yeah, absolutely. And it's really going to be data driven. And this is what CDPHE is going to be looking at. Hopefully it's not data driven in a direction that sends us to purple. I'm optimistic that these measures will be helpful. It does take about 2 weeks, to really see the impact of our efforts, of our plans. And I believe in the letter that was sent to us by CDPHE, this would be reevaluated on the 18th of December. To see where we could move along the dial. And I think if we saw things changing quicker than that, we have a really great relationship with them, and they're very open to our plans. And if we can show them, hey, this is what we're doing, this is what's working, we might have some flexibility in that. But as stated in the letter we were shared, it would be kind of that month, 4 weeks from now.
Great, thank you. Also, when the county moved to, I think it was last week, discussed a revised business mitigation plan. There weren't too many changes in it, and there was discussion about maybe submitting that onto an online platform. Can you just talk about what the requirements are in terms of that revised mitigation plan and any submission if need be?
Right, and I do believe that those appendices were updated. I think last Friday we went over those changes in the public health order. So they should be online currently through the Routt County website. So in terms of an online submission, I'm not quite sure where that stands right now, but I do think, something like that would probably be a lot easier. I'm just not sure what that status is.
Yeah, I think from what I've heard from Scott Kalman, it's just to have it ready and prepared to go. There hasn't been a formal online portal to submit it at this point, but definitely make sure that it has been updated, and it includes plans for when a staff member gets COVID. that you're
Yeah, and
prepared for
that's really, use those resources with CDC. They're going to direct your business what to do with an employee. We get calls all the time. Unfortunately, we're not able to return all the calls. So the more resources that people can use to build their plans to help them out, the better. And you're going to be able to act quicker and have solutions faster by using those tools.
Great. Just take another 1 or 2 minutes. There was a question about any lodging restrictions, and I think it was answered in the chat, but just wanted to reiterate that there are not any lodging restrictions in place at this time. And throughout the pandemic, the governor has kept lodging in the essential business category. However, the Routt County commissioners in the spring did impose a lodging ban for a certain time frame. But as of right now, there is not. And certainly the Lodging Association and the Chamber and others are in communication with Roberta and the commissioners to understand what the plans are so that everyone can adjust as need be if anything had to move into that direction. There's 2 other questions that I just wanted to jump to. One, Roberta, you can probably answer fairly quickly. Maybe if you get COVID, and recover, can you get it again?
Well, that is, what we're looking at with some of our studies. What I guess if there is a bright spot, if you do get COVID, and you test positive through a PCR, so that's the polymerase chain reaction test that is sent to a laboratory. It's kind of what we consider the gold standard. If you do test positive for COVID using that test, you don't have to quarantine for 3 months. So, if you came in contact with someone and you were determined a close contact, you kind of have that 3-month window or 90-day window of which you won't have to quarantine. And we've actually run into this situation, unfortunately, with our schools. But for now, we are still looking at immunity. Many respiratory diseases that we see circulating, you don't gain much immunity. This is why you have colds each season, potentially with the same virus. Some of these respiratory diseases, it can be hard to confer immunity, but we're still looking at that and the studies are ongoing.
Thank you. And we have about 1 more minute but to go here before we have to close it down, but best places to get COVID tests.
Like the 4-star COVID test.
Maybe fastest return is probably the question.
Is there a place that has testing plus maybe a beverage? I don't know. That would be the best for me. But it really kind of depends on your insurance situation. And at Public Health, we do have free testing, but we really want to emphasize that this is for our community members that do not have access to healthcare and that don't have access to health insurance. We are prioritizing people that are symptomatic and close contacts. But many of the providers in town, Steamboat Medical, Steamboat Family Medicine, and many other clinics do offer testing. So it's in some regards, if you do have insurance, maybe the decider is when a clinic can get you in. Everyone is jam-packed right now. So it's unfortunate, but we only have so many staff in the county that can do testing. So you may have to wait, but if you do have symptoms, you would be considered a priority.
Great, thank you. And I know UC Health has a fairly robust testing setup as well. I am going to wrap this up really quickly because we have another session to get started here momentarily. Roberta, thank you. I know that we all know that you have a really hard job to do. And we appreciate everything you are doing to keep our community safe and healthy. So
thank you. And we're in this together, everyone.
We are.
Shop local. Let's support our businesses. We'll get through this. But thanks, everyone. Appreciate it.
Thank you. And thank you to all of our other presenters and those who were able to join us and listen in. Please do reach out if there's anything else that wasn't answered today that we can get answered for you. Thanks again for sticking around a little bit longer. Have a good one.